Hey everybody, we're going to go ahead and take a look at rib structure. Um, let's start off with a rib that's pretty typical. Most ribs are more or less the same. They just have slightly different slopes to them, but there's a few ribs that are pretty unique, especially the last two ribs and the first two ribs. So let's just start with sort of your run-of-the-mill typical rib. We'll look at rib 7. So the first thing to look at, let's go ahead and remove a couple of these vertebrae. You know what, actually, let me look at just this rib by itself. Here we go. All right, so here's rib 7. The first two structures we'll be going over are the head and neck. Now, this app is really good, actually. I have very few complaints about it. Their rib here is pretty basic, but that's okay. So anyway, let's go ahead and outline the head of the rib here, followed by the neck. So where it starts to taper down, that is the neck of the rib. So head, neck. Now I'm going to bring everything back and show you something that's kind of interesting, and it's one of the few things that different ribs, it's one of the few differences between some of the ribs. So if you look at this rib 7, it's tough to see, but you can tell it's actually attaching to two vertebrae. So here's rib 7 attaching to T6 and T7. That's because it has two costovertebral facets instead of just one, like for example, rib 1, it just has one attachment to the vertebral body. So we call those um, we call those demi-facets or complete facets. So let's see if we can find a rib 7 again. So this has two demi-facets. It has a superior demi-facet and an inferior demi-facet. So if we were going to label those, it's not super clear on here. We got to find the right angle. I guess that's as good as any. We would say this area here is the superior demi-facet, and this area below is the inferior demi-facet. You can see they sort of form a wedge there that sort of fits in between the two vertebrae that attaches to the demi-facets on the vertebrae. The next structure we will look at is the articulating tubercle and non-articulating tubercle. They did not give us a whole lot to work with here, unfortunately. It's pretty smooth, so we're going to have to use our imagination a little bit. But if you look here, oh boy, they've kind of given us a tubercle here and a tubercle here. Now, on a real bone, it's pretty easy because the articulating tubercle is very smooth and the non-articulating tubercle is rough. And here's why. I'm going to bring everything back in. So the non-articulating tubercle is actually the attachment, sorry guys, bear with me, between the costotransverse facet and the rib. So the articulating tubercle is smooth. Now this might not go well, but let's add back in some ligaments and see if we can see. Okay, there we go. So there's a ligament that wraps around this joint, and the ligament actually attaches to the non-articulating tubercle. So the costotransverse facet is where the articulating tubercle articulates, and then the non-articulating tubercle attaches to this ligament. Okay, so the non-articulating tubercle is sort of right here, and it'd be rougher on a real bone. And then if we go ahead and hide this, this area right here, where it was attached, would be the non-articulating tubercle. So let's go ahead and go back to just the rib. So the next structure would be the shaft or the body of the rib. that's really everything from the neck down. So this whole structure is the shaft or body of the rib. Specifically, though, this one part of it right here, where there's an angle, is called the angle of the rib. Makes sense. I like when anatomy words make sense. Let's return everything. This here coming off of the end of the rib is the costal cartilage. Okay, so every rib has a cartilaginous attachment to the sternum. It may be indirect in the case of ribs 9 and 10, but other than ribs 11 and 12, they all have some costal cartilage connection to the sternum. Let's look at the costal groove. And they did a pretty good job with this here. This view is better. It's not the easiest thing to see, but you can tell the bottom is thinner than the top. And the reason being, oh, right there, you can kind of see it, is that there's a groove on the bottom half of this rib, like right here, you can sort of see it a little bit more pronounced. And that's where a vein, artery, and nerve sit. If you were to look at a cross section of a rib, it'd sort of look like this. And there'd be a vein, an artery, and a nerve running right there. And that's called the costal groove. Now the rib also has borders. So the top border here, which is thicker, would be called the superior border. So not the whole thing like the body, but just the top, the peak of the rib is the superior border. And then the sharper border below would be the inferior border of the rib. It's harder than you might think to draw a line with the mouse, but that is the inferior border. And then lastly, for your typical rib, you have an inner and outer surface. So this outer surface here is the outer surface, and then the inner surface here is the inner surface. And that's it for a typical rib. Now we will go ahead and take a look at some atypical ribs. So we'll just look at rib 1 and 2. Rib 10 and 12 are atypical as well because there's no costal cartilage connection, these last two ribs here. But we're just going to look at these two in more detail. So let's start with rib 1. Rib 1 is the smallest rib. It's almost horizontal, which none of the other ribs are in the transverse plane, and it is the shortest. Again, they haven't, I mean, they did their best here. Not every app is going to be as detailed as we go, but you can't see it great here, but just so you know, there is a tiny tubercle on rib 1 called the scalene tubercle. And I don't really think that they've put it in here, so we're just going to use our imagination a little bit. But it's right about here. And you can see this on a real rib. There's a little, it's pretty pointy. There's a little notch right here. That's where one of your scalenes attaches. And actually, rib 1, if you have bad posture like I do, you can feel it. It's not fun to put pressure on because your scalenes are typically so tight if you have forward head posture. But if you push down on rib 1, you can actually feel a rib right there. So it's right at the base of your neck, kind of what where you would consider your traps to be, but a little anterior to that, right on the side of your neck. You can push down. You may even feel some radiating pain in your arm because you have a lot of nerves that exit right there. Anyway, one of the reasons that structure is important to know, other than that it is a muscle attachment, is that you do have another structure on either side of it. Can't see it great here, but these are two grooves. One is the groove for the subclavian artery here. So your subclavian artery comes out over the top of rib 1. And one is the groove for the subclavian vein, which goes this way. So you have two really big blood vessels coming out right there. This rib does have a complete facet. It doesn't have a demifacet. It's one of the handful of ribs that has a complete articulation with its vertebral partner. So if we remove this, we can see right there on the top of the head of the rib is a complete facet. And that matches the complete costovertebral facet on the thoracic vertebra. And then it does have an articulating tubercle as well, like the other ribs, that articulates with the costotransverse facet of the vertebra. And that articulating tubercle is right there. And that's it for rib 1. Let's go ahead and take a look at rib 2. Rib 2 is the second smallest rib, but it's about twice as big as rib 1. It's right here. It has a couple interesting structures as well. Again, though, unfortunately, they aren't super visible. I mean, it's really not visible at all, unfortunately. But this region, is normally roughened and raised, and that's because a piece of a muscle called the serratus anterior attaches there. Specifically the second digitation. If you've ever seen a serratus anterior, boxers usually have really big serratus anteriors. It's a muscle on the side of your rib cage that looks serrated because it has fingers. And if you just want to Google serratus anterior, you can see it. Or you know what? We're here in this nice app. Maybe we will see if we can add it in. So let's slowly add some muscle in. Oh, too far. Oh yeah, okay. They did a pretty good job. There's serratus anterior. And you can see the second digitation of it, the second finger attaches right there. I wonder how far off I was on where I put my mark. I think I put it down here. It's tough when there's nothing to see, so it's more over here. So anyway, that is called the tuberosity for the second digitation of serratus anterior. Let's take this muscle away. Okay, unlike rib 1, it has demifacets. So it has a superior and an inferior demifacet. Okay, so let's draw that in. This would be the superior demifacet and the inferior demifacet. So the inferior demifacet attaches to T2, and then the superior demifacet would attach to T1, which isn't in this picture. And then lastly, for rib 2 is the articulating tubercle, which articulates with the costotransverse facet. So this smooth area here on T2 is the costotransverse facet. If we go ahead and remove that, we can see the articulating tubercle right there. And that's it for our rib video, you guys. Thank you.